Academic medicine is uniquely complex just in terms of how the organizations, first of all, organizations aren't all structured the same. So academic medicines might look different at different institutions, but also in terms of just the overall mission and then organizational structure and engagement. So a single school of medicine might be accountable to a hospital, a health system, the academic side as well as research. You have faculty who are responsible across all of those areas. So many different data points, money flowing between organizations. Sometimes they're not organized, they're not actually a single institution. They might be reported on as separate institutions. So that builds, silos and structures. And sometimes that forces different systems around, where the data lives, how to pull the data together.
So what's very different about academic medical centers and health science centers is the complexities that they bring that are very different than the university side. However, they live within the confines and the governance of an academic university. But they have to operate very much like a business where they have to bring in the revenue to cover a salary. They're running billing where they're billing for patient care, right? So they're doing the whole thing that we have as a mission, which is teaching, research, and service to an extra level, because now it's patients' lives that they're serving. And then bringing all that together to run it like a business, the operating model of running the medicine side from a clinical operations, the complexities of a clinical operations is very different than the academic side where you're receiving funding based on tax funding or multiple levels of tuition funding. On the medicine side, you're really trying to cover your salary by treating patients and making sure you're bringing enough funding to cover those things. What makes AMC so complex is that from an enterprise perspective, they run very different than the academic side. Their funding is not coming from the state. They have to generate their own funding. You have to operate like a business. And frankly, they have to save lives. I mean, you do have to save lives.